Ministry of Health records 4 new COVID-19 positive cases, while 4 persons were discharged from the government system at the Caura Hospital. One of the 4 positive cases is a returning student from the Barbados cohort, while the other 3 are from a group of people recently deported from the United States. The Ministry of Health confirms that all the cases are imported. Trinidad and Tobago has submitted 5,089 samples to CAFA and UWI labs for testing thus far. The number of samples which tested positive altogether are 130. The number of discharged persons is 113. Members of the public are reminded that they must adhere to the new normal recommendations to protect themselves and their loved ones from COVID-19. Among those recommendations, wear a mask over your nose and mouth when you go out in public. Keep your distance from others, 6 feet. Stay home if you are ill. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. PAHO WHO Director Dr. Carissa Etienne is urging leaders in the region to continue to be vigilant in the fight against COVID-19. This, as she said, many Caribbean islands have been able to curb transmission of the virus. The Americas have reported more COVID-19 cases than any other region in the world. But during PAHO WHO's weekly media briefing, Dr. Etienne said most countries across the Americas have implemented effective public health measures that slowed the spread of the virus and saved countless lives. Mahalia Joseph-Wharton has more.
Several Caribbean countries and territories were able to curb transmission of COVID-19 completely and have reported no new cases for several weeks. PAHO WHO Director Dr. Carissa Etienne said the goal now is keeping transmission under control.
In the absence of a vaccine or effective treatments, the tools we have at our disposal are limited, and we have no option but to make the best use of them. Complacency is our enemy in the fight against COVID-19.
She said most countries across the Americas have implemented effective public health measures that slowed the spread of the virus and saved countless lives.
We need to double down on measures that save lives early on and to deploy them with more precision than ever before. We must let data, not passion, guide our actions.
She said as countries that have controlled the spread of COVID-19 start planning to reopen their borders, timing is critical.
In countries highly dependent on tourism, resuming non-essential international travel by air and sea will require additional measures by operators of conveyances at points of entry and in the hospitality industry. Arrangements must be based on scientific evidence, on global, regional, and national epidemiological situations.
The PAHO WHO Director said countries resuming such travel must do it in a progressive and orderly way and must also modify measures if transmission increases and health services are compromised. Mahalia Joseph-Wharton, TTT News.